With Dr. Mait, the other doctor that is here at STEMS Health in Miami Beach. And you want to introduce yourself a little bit?
Sure. Hi, fans. So my name is Jared. I'm a medical doctor. I've been working with Dr. Choksi since we started actually training together in anesthesia in 2013. So I've known him a very long time, and so my time spent in internal medicine and working with a lot of patients in a concierge setting with a lot of functional medicine, I've come to understand a lot in the regenerative capacity of the body. And so, having gone through this, Dr. Choksi and I decided to start a regenerative medicine practice a couple of years ago to kind of give the best in class stem cells and regenerative medicine.
I feel like of the places that I've heard of in the Miami or the South Florida area, this feels like this is like the top. I know maybe you wouldn't say that out of modesty, but
yeah, I mean,
as a patient who's come in here.
Well, it's because we're on the top floor.
Ah, I see now.
Yeah,
top floor, top of the industry.
Yeah.
Got it. So you guys actually went to school together, and you've been practicing for a while now. And my understanding is Dr. Choksi specializes more in the actual day of procedures, maybe the actual needles, sure. And your focus is more...
So my focus is really in the internal medicine and functional medicine component of it, trying to understand if the patient has other medical conditions going on and just kind of assessing like the totality of the patient, but more, in line with delivering the quality of service that we've come to kind of give to our concierge model as well, being that, we have great back-end support, we have great day of operations, post-care follow-up, arranging for physical therapy after the fact, and just being there to support the patients the whole way through.
So you mentioned the concierge side. So far we've only discussed the stem cell, the regenerative medicine side. If you want to talk a little bit more about what you offer on the concierge end.
Yeah, so...
that's new for me to understand concierge medicine.
Yeah, so concierge medicine is a model where patients have access to kind of the suite of services that medicine can offer without having to go through insurance, without having to go through like a huge front office to access a doctor. So we're available 24/7. We have a team of nurses, nurse practitioner, and a back office staff that really kind of supports a patient's goals in medicine. So one of the things that we bring into STEMS is kind of to go back to more of the work that I'm doing to support STEMS patients is with a lot of peptides, regenerative medicine techniques that are outside of the scope of injection. So we're doing a lot with different healing peptides. We're using BPC-157. We're using different growth hormone analogs, ipamorelin, CJC, testosterone, sermorelin, and growth hormone as well, in order to kind of augment the healing process.
I got it. Okay, so now I'm starting to see a wider scope of what your practice does. I've had kind of like a brief understanding of peptides. I had my blood work done a few years ago. The place that did it also, I think, offered them, not nearly to the level that it seems that you guys do. They're more of like an IV drip therapy that has this as like an add-on. So I guess I'm curious, and for anybody watching, what some of that means, because you threw around a lot of terms that,
Sure. So, listen, peptides are proteins, and they're arranged in a certain conformation, and then they exact their function on particular cells. Now, within this kind of framework, what we're trying to do is target a specific action. So whether it's growth hormone going to the pituitary to stimulate the release of growth hormone from there, there's so many downstream effects that happen from peptides. So it's varying. If there's a specific peptide, I'm happy to go through.
But it's natural. It's not like a steroid.
These are not steroids. No. There's some that, let's say kisspeptin, which is, a pretty common one. This will help stimulate testosterone production. So you can take testosterone directly, injections. Right. We don't really recommend it for younger individuals, as it can influence fertility and kind of inhibit, sperm.
But this is like a hormone replacement, or it's not hormone related, but it affects hormones?
Well, yeah. So kisspeptin would induce the production of testosterone naturally versus injecting yourself with testosterone. So it's a little complex.
Yeah, I've had lots of friends in the bodybuilding world that are doing a variety of different hormones for bodybuilding reasons, performance, and, from testosterone to growth to be, big. And the one thing that's always turned me off about that, other than the fact that I don't want to walk around that big, is that I know once they're done with the cycle of steroids, they're then going to have after effects, side effects. It's going to mess up their hormones. Do these peptides that then trigger the hormones have the same effect?
Yeah, so I mean, I think everything should be managed medically, right? So I don't like to put down other places because they may have amazing nurse practitioners or doctors or medical directors that are overseeing it.
Mm-hmm.
From my perspective, it's really important to have someone manage it from start throughout and then to finish, to understand what your goals are, what you're trying to prevent, what your age is, how your kidney function is, how your liver is, how it's actually impacting testosterone levels, too high, too low. Is it suppressing the pituitary if you're taking testosterone? So there's like a lot of nuance to it. But, depends on what you're taking will influence whether or not it's going to affect your fertility, whether or not it's going to see a complete drop off. So if I give you, let's just give an example, testosterone injections. You come in, you say, hey, I'm a little sluggish. I mean, you wouldn't, you're like in great shape and you're young, but let's say you're a 55-year-old guy and you're feeling a little sluggish, you're just not feeling strong, you don't have the energy, your sex drive is down, and you say, hey, listen, I want to start testosterone. So we get your levels, and let's say the relative range is between 200 and 1100 on total testosterone, and you're 350. So we say, let's make a plan and put you on testosterone. You take testosterone, you're feeling great for 10 weeks. If I were to let you drop off of that completely, in week 11, 12, you're going to feel like a bus hit you because you went from having normal testosterone around 1200 because we're testing throughout. By the time you're done, you may drop down to 200 because we've suppressed your testicles from actually making testosterone. So there's a trimming the bonsai tree, I like to say, like making sure that we're going in the right direction. But there's things we can be doing along the way, right? If we're giving you testosterone, we can also give you clomiphene in order to preserve testicular function and ensure that when you do come off of it, we've already given your testicles the advance notice that we're going to start asking them to produce their own testosterone. So it's a beautiful dance, and it's having a great team to make sure that we're testing labs, that your symptoms are good, that you're not having side effects. So we kind of do it really responsibly.
And just for me personally, I've always been turned off to the idea of like anything that's not natural drug related, but to each his own. I totally respect the innovation and advancements in medicine and whatnot. I want to go as hormone free hopefully my entire life. We'll see how I feel. I'm 33 now. We'll see how I feel in 10 years, another 10 years.
Sure.
I think I got my blood work done 3 years ago and my testosterone was around 700. I think that's, as far as I was told, that wasn't something to be concerned with at the age. But I also have a friend whose grandpa is 90 and his is like 850 or something like that. And then you mentioned it can go up to 12. Do I want to try to get it higher?
Yeah, this is nuance. I mean, so when we start going into like testosterone, we start looking at other levels, right? So we look at total testosterone that has a range up to 1200, let's say. Free testosterone, we're starting to go closer to like 150, 160 on that scale. And then we go for sex hormone binding globulin. I don't want to like bore your followers and fans and everybody who likes how straight you are with them about being healthy.
But I know that they might consider it, so it's good.
Yeah, I mean everything has to be explainable. So let's say your free testosterone is 150 and your total testosterone is 750. There's no way I would give you testosterone because you have enough available free testosterone, and that's why your body's not making more.
I see.
In certain clinical conditions, hypothyroid states, hypoadrenal states, what have you not, if your sex hormone binding globulin, which is made by the liver, and it binds to free testosterone, sex hormone binding globulin is sky high, you're going to have really low free testosterone despite giving you testosterone or giving you something that's going to make your testosterone higher. It's going to be bound. And so we have to really either work on taking a supplement for that, a medication for that, or figuring out the underlying cause. If you have Hashimoto's thyroid disease, we need to get an understanding for that, and then kind of probably do what you're doing, a lot of natural changing diet to kind of curb the inflammation that's associated with thyroid destruction.
Yeah, and I love that you mentioned that because I don't have a medical background to speak on these things from a credible point of view. No. But I do believe, from the things that I've read, and some of these are published medical, documents, that there's plenty of things that you can do naturally before then exploring, what other alternative options are out there. So basically, somebody can come into STEMS, they can explore PRP, they can explore stem cell treatment for any sort of injuries of the body. They can work with the concierge side and yourself to have their blood work done, analyzed. I think that's the most important thing. A lot of places that'll do your blood work, there's a lot of different levels of analysis that you'll get. I think a lot of it depends on what that office is then trying to sell mainly. Like where I mentioned that I got mine done, I think I got a decent run through, but I didn't even hear what you just talked about the free testosterone or the hemoglobin. Is that the right
Sex
term?
hormone binding globulin.
It's
a mouthful.
Yeah.
I said it enough.
So I imagine there's just so many levels to that. And what I love about Dr. Choksi with the stem cell and now yourself is just being able to get in-depth responses. It's always different, the doctor that you speak to, and without talking down on anybody, just
sure.
Some doctors are extremely busy. Maybe some assume that this knowledge is everyday knowledge, so sometimes you get bits and pieces, and sometimes people get into the nuanced information about stuff.
Yeah, I mean, listen, I think, like I say to everyone, it's your body, it's your choice, right? If you don't understand what it is that are the side effects, the downsides, or even the why we're doing it, you can't make an informed decision. And so for me, it's I'm going to take the time really early on to explain to you in the best way I can why we're doing it, what I see, what it looks like in the whole holistic arena of what you're trying to achieve and how your body's going. If you understand that, then you're going to make a really good decision and be on board for why we're doing it and not guessing yourself the whole way and maybe kind of I'm going to go on Google and find something, against this or for this, or try to augment your own knowledge. It's good to get your own knowledge, but if you're coming to a source, I should be able to take the time to answer your questions. And I think we do that really well. On an average, lab review for a comprehensive lab, we usually spend around 30 minutes going through what we tested, why we tested it, what we're looking for, what it doesn't say. So, hey, you aren't anemic, or you are anemic and this is what it means and this is where it could be coming from and this is what our plan is. And then going forward, it's really comprehensive and it's fun doing.
Well, I love that. And that's been my experience so far in chatting with you guys. So that's one of the definitely one of the top pluses, at least I've experienced with STEMS. You mentioned anemia, obviously, because I mentioned it to you before we were filming. Sure. I had a scan, an MRI done of the disc in my back. I also have a possibly herniated disc, where the radiologist suggested that something in the image might suggest I have anemia, which I guess is a surprise to me. So I'm going to have them do my blood work. Is there a benefit to me not doing it with them and doing it with you guys? Because obviously I could get the results, bring them, and then we could have the conversation. Is there different blood work?
No, I mean, listen, we work with Quest Diagnostics and LabCorp and Genova being big labs that we work with, because we try to go to the gold standard and not some random lab that gives cheaper prices just because. But, so we work with the best. There shouldn't be a difference. Mm-hmm. There should not be a difference.
They'll test for everything. They'll know.
Yeah, I mean, these labs have standard operating procedures.
Full blood work analysis gets you.
Well, I don't know what they're going to test for.
Yeah.
But if they're doing an anemia workup, there's usually an algorithm, trying to understand why you have anemia. I mean,
well, should I scrap it with them and come to you guys because we know you can give me full scope?
You can do whatever you want, but I'm going to tell you, if we're doing an anemia workup, it's going to be pretty much, if it's focused, right? If we're doing is Adam healthy?
Yeah.
Then that's a different workup. You're going to get a different one over at, an internal medicine doctor versus coming to a functional medicine, concierge medicine practice. But if you're a healthy guy, there shouldn't be things that are off at your age. But if we're doing an anemia workup, just anemia, and we're saying, okay, could this be B12 or folate anemia, or could it be an iron deficiency anemia? Those are standard things that any well-trained physician should be looking at. Mm-hmm. And if those things are not looked at, then obviously we look at it. If all your numbers are normal or something's a little bit off, then I think step 2 would be coming to a place like us to look at it. But Yeah, I think.
Well, I'm only asking because one, I'm here with you guys anyway, and where now he's suggesting doing the blood work for anemia. I actually just want to get my blood work done to know my testosterone, free testosterone, vitamins, I don't know, inflammation markers, pretty much like what you usually get to look at your health. I don't think he's going to do that. I'm sure he could, not. Right? But I don't.
Well, I mean, listen, we have a lot of labs that we do, right? So we try to get like a really complete picture of what's going on in someone's system. We work with Genova, like I said before, and we do a Nutri-Eval, which is a really comprehensive look at how your body's metabolizing energy from fats, proteins, and carbohydrates, how your antioxidant levels are, which amino acids you're deficient in, how your methylation pathways are working, heavy metals, omegas, micronutrients. So we're doing like whopper of panels to try to understand why you're taking a supplement or which foods you'd get higher amount of those things in, whether it's alpha lipoic acid or glutathione or thiamine or what have you not. So we do a lot. I mean,
there's levels to this. It's looking like you can really drill in deep.
Yeah, absolutely.
So bringing the conversation back to STEM, I guess, before we wrap it up.
Sure.
Just because, obviously, speaking to Dr. Choksi, he's doing a lot of these surgeries, and you're working with the patients to, find the right PT or the post-game plan, I guess you'd say. The more people that I speak to that have had a similar injury, that have had amazing results, just helps me build confidence. So I guess, without promising that I'm going to see something, I'm just curious, anybody else that's had a similar injury that you've had the experience of working with that's had a positive outcome? I'm sure.
Yeah, I mean, listen, every case is different, right? It's hard to just put people into a category, but we would never take a patient that had something that needed to be operated on, right? So we reject patients all the time. Someone comes in, we get an MRI or a CAT scan, and we say, hey, the nature of your injury is so severe, we're not going to try a stem cell. We're not going to try a particular type of PRP injection or hyaluronic acid, what have you not. We're going to refer you to one of the orthopedic surgeons that we trust. If they say surgery is not an option here, we don't recommend it either, then they'll come back, we'll do an injection, and then we start putting them on either a growth hormone analog, we put them on BPC 157, or we'd start them on physical therapy, of course. So in regards to your injury, I mean, I think your outcome's going to be exceptional.
Yeah.
What you're going to say.
That's what I wanted to I just want some excitement. Because it's such an odd injury to have a meniscus thing. I know everybody's meniscus injury is different. My dad tore his, couldn't walk. My best friend tore his and his knee completely locked, so he had to get surgery to even straighten his legs.
Sure. Months
and months recovery, probably over a year recovery when all was said and done. And then when he came out of his meniscus, and this is probably the one friend I have the closest relationship to have some scope of how bad things could be. Tore his meniscus. He's a very inflexible guy, but tore his meniscus. Got the surgery, came back, and then went to the park, and because he's inflexible, everybody told him he needs to do more pigeon stretching of the hip, because he can't even do this, his knee's all the way up here because he doesn't have this. But this puts so much strain on the meniscus, he tore it again stretching.
Wonderful.
Yeah, his first day back stretching, tore it again. Felt so bad for the guy. And for me, I could do a backflip right now. I could go play basketball right now. It just doesn't mean that I'm going to be able to walk on it tomorrow.
And you don't want to make it worse, right?
And it's trying to step in front too, which kills me.
Yeah, I mean, listen, you can go for shoulder surgery or knee surgery, and maybe the outcome's going to be good, but you're going to be out of commission for 4 to 6 weeks. You're going to be in physical therapy afterwards. You come in and you get an injection into your knee here, and we've determined that it's something that should respond. Maybe you don't have the great outcome that you were hoping to achieve, but you have no downtime. You have a couple of days where you're like, oh, okay, I feel that they put some, fluid, whatever it was, inside of the area. But this isn't the risk isn't, now I'm in a sling for 6 weeks. Or now I'm, in a straight, soft cast for, 2 weeks, and I can't exercise, and I'm at a higher risk of clotting.
Something good, right?
Which?
Even if it doesn't get me the outcome that I want, it's still stem cells, which have all of the amazing properties. So it's healing even micro. Am I far off by suggesting that?
Listen, stem cells are going to help whatever it is that we know and what we don't know, because they have the capacity to regenerate tissue that is being called to action. I don't think this is something that you're going to have a downside to. I think you're going to recognize that you're going to have benefit only. If you do a repeat MRI after the fact, you're probably going to notice in a short amount of time that you have repair of the meniscus. Most people aren't going back for a repeat MRI, but if you did notice that you were improved and you went back for a repeat scan, you're going to go, oh wow, like I can see the difference between these two MRI reports, which is fantastic. If you have a complete tear of your meniscus, I don't know any responsible regenerative medicine person, responsible, honest, who would say, come in, get a stem cell. If it doesn't work, you can go for surgery. You're delaying the inevitable. If anything, you could be causing more injury by going in.
So in that case,
that's why I think that I'm excited to work with Dr. Choksi, and he's excited to work with me. Like we're honest people. We only want to help people.
You guys seem pretty
should be helped
with that stuff.
Yeah. And we've known each other, what are we going on, 11 years now.
So then I guess in that situation, it would make sense for somebody to have the surgery. If they had the fully torn meniscus, have the surgery, then maybe get stem to help recovery of the surgery.
Yeah, so that's, usually we work in alignment with the surgeon to make sure, they're very protective over what they've done.
Yeah.
And so we would never want to introduce something into an area that is currently healing, but we would use BPC, we would use a growth hormone analog or even growth hormone in someone who wanted to do it. We would recommend going into hyperbaric. We would make other recommendations on things that you should be doing. We don't offer hyperbaric here, but there's certain things you should be doing.
Yeah.
And physical therapy across the board. So
right.
Long-winded answer. We wouldn't navigate inside of the needle, 2 weeks after your surgery.
No, but again, I think it just reiterates the honesty of if you have your injury, we're not just trying to get you to come to us for our service for your money. Like, we want you to get the best care because at the end of the day, everybody wins.
Yeah, I mean, not as a pitch for us, but let's take not you, but someone else, right? It's worth taking a call with us.
Yeah.
To say, hey, I have this injury, I went to a surgeon, they want to operate, but I don't want a surgery. Maybe I should go to these guys. They're going to be honest with me and not just inject. If they tell me I really need surgery, they don't do surgery, right? We're not doing surgery. So if we tell you, hey, listen, we can do a good job with this, you don't need to go to surgery, then you have another option. You can balance it. You could speak to a third party, but you should have a second opinion. If there's a complete tear and the MRI says you have a complete tear, then you don't need to waste your time. You need to go for surgery.
That's why, so far, the network that led me to you guys was the PT that I found through a random neighbor in my apartment building, but he's down the street from my gym. Extremely knowledgeable guy, super honest. Went to him, top surgeon for knees in Miami. He didn't say I needed surgery, but he basically said, so what do you want to do? As if I knew what was best to fix my knee. I didn't know. He's like, well, we can cut you open, and that kind of turned me off. And as I explained before when Dr. Choksi was in here, they don't know when they cut you open until it's going to be 6 weeks recovery or 6 months if they trim it or if they sew it. And it scared me, so I went for a second opinion, and I loved that a doctor was able to say, no, there's so many natural things that you can do just from fixing movement, finding the imbalances in your body. He was doing a lot of needle therapy, dry needling with electrolysis.
Yeah.
I saw a lot of improvement, but it's slow and I'm just not where I want to be. And again, this is my career, so he's the one who recommended me to you guys. And I just feel like I'm dealing with a whole new age of medical professionals than what I'm used to in my small suburban town, where they kind of just stick to the book and just one person and the next person, and it doesn't seem like they love it, doesn't seem like they hate it, it's just a job. I don't know, I feel like talking with you guys, there is a different level of care.
Yeah, I mean, listen, our back office is pretty deep, right? Outside of here, we have 6 people that are ready to help.
Yeah.
Right, and we have not 20 patients in the waiting room. So our goal is to make sure that you're taken care of, and that's our whole mission. And we have great outcomes, and people keep coming back because of it.
Yeah. Well, it's been a great experience so far.
Cool.
I guess the last question to wrap this up is, if anybody's watching, trying to learn about stem cell, obviously knee injuries, back injuries, I think it's something like a crazy high percentage of people are going to experience this in their life. So that's obviously very viable. I'm curious, past this, and hopefully this goes well, I'm not very optimistic, what else could I use stem cell and or PRP for? And I've heard, for instance, possible hair regrowth for PRP, which I definitely want to explore, because as I get older, that's not working to my advantage genetically.
The aesthetic, I used to be bald, and I did it just once. I'm kidding.
You have me sold.
Yeah. So the aesthetic community with PRP is like growing, right? Like you can do PRP for regeneration of hair follicles. You can do PRP for regeneration of skin. You can do exosome therapy for regeneration of skin. FDA approved exosome for burns.
What's exosome?
That's a whole nother conversation.
Okay. Next video.
Yeah. So you can there's let's stick back to PRP. You can use PRP for your hair, you can use it for the face. You can also, one cool thing that we offer is we do diagnostic ultrasound. So we have one of our ultrasound techs come in and we do a total body ultrasound. So we'll do ankles, we'll do knees, we'll do shoulders, we'll do hips, we'll also do the Achilles, we'll do the palmar fascia. So we look at the whole body to see, like, are there any areas that either look off, are off, but you're kind of neglecting because you assumed it was something else. And we come up with a plan. Physical therapy should be injected while we're already there. So there's a lot,
Yeah.
Yeah.
Wow. Now I'm so curious what else they might find now that you can look under the microscope and get so close.
Yeah, I mean, listen, I would never recommend that someone does a preventative PRP or preventative stem cell just because.
But for hair, I can preventative, so I don't lose it?
Well, I mean, it kind of would go in line with regenerative. So, like, I wouldn't do PRP for my hair at this point. But if you feel like there's troubling areas for you that are thinning, then yeah, of course, because you want to draw more blood to the area.
I'm really good at kind of hiding my thinning area. I'm going to do the non-camera side, but like, like if I could PRP where I know, like my family has cul-de-sacs. All the men, they got the cul-de-sac thing. If I follow either my mom's side or my dad's side, I'm going to keep it on the sides. I'm going to lose it off the top. Other than going to Turkey in the future for them to pluck it out of here and put it in there, yeah, if I could do something to...
Start PRP early, you can start, using other types of medical therapies for it as well.
Yeah, I'm trying, the minoxidil stuff. Actually, last time I was in here, you gave me that suggestion. I'm doing the oral one now and the cream. No more finasteride.
Yeah. Well, the finasteride's going to block the dihydrotestosterone, which will cause more male pattern baldness.
Seems counterintuitive.
You mean to block?
Oh, it blocks what makes you lose it, right?
Yeah, so having higher testosterone is going to cause that to stimulate the receptors that will cause that male pattern baldness.
Right. Man, I just want to grow it back and not lose it. Wouldn't that be nice?
Buy hats.
I always
go religious. Wear a yarmulke.
I do that. You do, but you wear it over the put. See, I don't lose it back here. I'd be good.
Okay, so
then
you have to wear 2 yarmulkes or a bra. Rabbi and put a whole thing
the beaver hat.
You need the whole thing. Yeah, the beaver hat, exactly.
So yeah, let's wrap this up with. So I hope everybody listening got a great rundown, a bunch of really useful information when it comes to stem cell therapy. Regenerative health, the difference between PRP. Hopefully you have an understanding of what STEMS here in Miami Beach can offer. Obviously we're making this video here in conjunction with the business, but my experience of a lot of the different doctors' offices that I've been to in Florida I felt like this is a whole different level of care. In chatting with you guys, I feel definitely like I feel like you guys care. I feel like all of my questions have been answered. I definitely ask a lot of questions. They've been answered thoroughly. I have a much greater understanding, but also I feel so much more comfortable knowing that if you knew me, my background, like I don't really do anything that's unnatural as far as supplements. I'm against steroids or anything that I think you could do naturally. I try to go that route.
Sure.
But I also understand if you get injured, sometimes that's unnatural. And an injured animal might possibly die and not have the option of surgeries or stem cells or whatnot.
And injuries compound, right? Your knee hurts, and so you offset it with your hip, and then your hip starts to go, and then your shoulder starts to go, and then your neck starts to go, and you get migraines, and you start grinding your teeth. So it's like started at the source.
You hit 4 of mine right there. So.
Yeah, that's a natural domino effect.
And I heard it's kind of like a spring. It kind of like bounces across the sides of your body. So yeah, I mean, there's definitely like the nervousness in me. When I was first told I needed surgery, like I left there just stressed. And then when I spoke to my PT who said, no, there's other options, I left relieved. And then a year into the other options, I'm still optimistic, but now what else can I do? Talking to you guys, STEM, okay, they're gonna suck something out of my body, they're gonna stick needles in. Again, it gets me nervous, but after talking to Dr. Choksi and you, and I'm not just saying this, like I really do feel significantly more comfortable.
Yeah, when you get to the center that we're doing the procedure, you're gonna say, oh, okay, this is high quality, super sterile,
fuzzy white
center.
slippers type of thing.
Just, yeah, I mean, you're not in some, back office and somewhere getting a bone marrow stem cell transfer.
And when I was in Colombia not so long ago, I met a guy in a cafe. I feel like that's the start of a lot of stories. I met a guy in a bar who works for a stem cell place. I won't say clinic because I don't know. He was like an off the streets Brooklyn guy that had been living in Colombia for 10 years. And he's like, yeah, I got you for 1/5 the price. You come in. He's like, you want to do it on Wednesday? I'm like, can I get some information? He's like, oh, the doctor doesn't want to be bothered with information. Like maybe I could set you up on a call for 2 minutes. I'm like, how many people are you selling? Like, how many people want this cheap therapy that's just convinced that it's going to work for them, and it really will be in some, like, basement, backyard medical office of sorts? That's terrifying.
Well, that's when we get a bad name, because people have bad outcomes. And they go, oh, it must have been the stem cells. When it's not.
Right.
If you do it right, you should get great results. All things being considered.
Yeah.
I mean, we know our source of the stem cells. Things need to be done right or not at all. And so, kind of our motto.
Right, and as with everything in life, there's just levels to right. There's the skills that come with the experience. 15,000 procedures is quite a lot.
Yeah, no, I trust him. He's injected me. So
I don't even know if I've done 15,000 pull-ups in my life.
Right.
No, maybe.
Lunges.
Yeah, that one. Anyway, I hope you guys got a lot out of this. Really appreciate your guys' time. I'm definitely looking forward to making this thing happen and seeing if I can get back to 110%.
Yeah,
or more.
absolutely.
Appreciate it. Thank you.